Hello everyone, this is Dr. Sushma Sarala, consulting homeopath at Fidicus Home. Signs and symptoms of AUB. What are the primary signs and symptoms? So remember, if you're suffering from AUB or if you're suffering from any of the menstrual irregularities, there are 4 key points every doctor will look into. What is that? The first thing is cycle regularity. That means if you're having a 25-day cycle, if you're having a 20-day cycle, if you're having a 10-day cycle, so what is the cycle? That is, the cycle means the first day of your period to the next first day of your period. What is the cycle that you're going through? That is important. If it is irregular, it will come under AUB. What is the frequency of the menstruation? As the cycle decreases, the frequency increases. That means if your cycle is every 15 days, so the frequency of menstruating is also more. So depending upon the frequency, if it is regular or too frequent or not too frequent, we will know if you are suffering from AUB or not. And then duration of the menstrual flow. For example, your cycle is every 28 days, but the duration of the period that you are in your menstruation, that is during the menstruation. If the period is prolonged, then that can also be coming under AUB. If it is shortened, that can also come under AUB. Volume of menstrual flow. So the volume of menstrual flow, for example, even if you are suffering from abnormal uterine bleeding and there is spotting, that is very less blood is there, then that will also come under AUB. More amount of blood, even in 2-3 days, that will also come under AUB. And what the other sort of thing that will come under AUB is the passing of large blood clots, that can also come under AUB, and also bleeding between the periods will also come under AUB. What are the other signs and symptoms associated with it? Bloating. Remember, bloating is a common problem. Many people feel bloated. They have like this puffy eyes, puffy face just before menstruation, and it decreases usually after menstruation. So if you're having puffy face or puffy eyes and you're feeling bloated throughout, and then there is breast tenderness, pelvic pain, especially in the lower hypogastric region, extending to the thighs or extending back, or you're having backbone problems while you're menstruating, dizziness or fainting because of prolonged menstruation, weakness because of prolonged menstruation, low blood pressure, elevated heart rate, because if you are bleeding too much, there is less amount of iron, less amount of hemoglobin in your blood, then your heart has to pump a lot of times. That can lead into elevated heart rate. And also pale skin, because there is anemia, you will have this waxy pale appearance of the skin. All of these features, if you're suffering from any of these features, you will come under the AUB criteria. See, many people feel that if they are suffering from any menstrual irregularity, they feel that it can be because of stress, it can be because I'm in the perimenopausal stage, or it can be because I'm in the menopausal stage, or it can be anything. They just feel that it is common. Okay, it is just the bad blood going. See, remember, there is nothing called as bad blood and good blood. It is pure blood. That's it. So if you are bleeding too much, then you have to consult the doctor as soon as possible. What are the severe symptoms of this AUB? Bleeding and soaking of the pad 1 hour after you keep it, or 2 hours after you keep it. So every 1 or 2 hours, if your pad is soaking with blood, you should consider doctor. And then weakness and you're fainting, there is dizziness, and there is low blood pressure associated with pale skin. If you're having any of these features, these are considered as severe features. Do consult doctor as soon as possible. If you're watching this video and if you're suffering from abnormal uterine bleeding, so you can consult us through online or offline options, as we are having good success rate in treating these diseases. If you are staying nearby the nearest branch of Fidicus, you can come and contact us in person. If you are staying outside or you cannot reach us in person, you can contact us online either through audio call or through the video call. And also, after doctor consultation, you can share with us any sort of investigations that you've already gone through, and if we need any more, we will let you know. After all this doctor consultation, we will deliver the medicines to you, or the medicines will be sent through courier. If you're staying in India, it can take 3 to 4 business days. If you're staying in USA, it can take 3 to 5 business days, and across the globe, it can take 4 to 8 business days. If you're suffering from abnormal bleeding and you would like to get in touch with us, you can call us through this number. You can WhatsApp us, you can ping us or message us on this number. If you would like to know more about Fidicus Homeopathy, you can check this website www.fidicus.com. If you're suffering from uterine bleeding, if you're suffering from any sort of female complaints and you're looking for cure, why should you choose Fidicus Homeopathy? Remember, Fidicus Homeopathy stands for highest chance of health. Here we follow 3 principles. Primarily, the reason for doing this video is the high amount of success rate we are having in already treating the uterine bleeding, that is abnormal uterine bleeding cases. The transparent treatment here at Fidicus, that is, there is no gray area between the person and the doctor. We will be educating you on the prognosis of the case, the cause of the case, and everything. and also the personal care here at Fidicus. So what is the personal care that we give? If you're sort of having any sort of dilemmas, myths about this condition of yours, we will educate you on that. So if you want to choose cure, choose Fidicus Homeopathy. Thank you.
Fidicus Homeopathy.